Dallas. I'm chairman of the Archives Committee for the American Association of Neurological Surgeons. The AANS is meeting in Washington, April 1983. We have the privilege today of visiting with Dr. Dan Ruge, who is the neurosurgeon from Chicago, who is currently the president's physician. Dr. Ruge has had a distinguished career in neurosurgery. We want to visit with him about that career. Assisting me today is Dr. Charles Neblett, also a member of the committee. Neblett's from Houston, and has been a close friend and back next door neighbor of Vice President George Bush. But today we're visiting with Dr. Ruge, and Dr. Ruge, it's a pleasure to have you with us, and we appreciate you visiting.
Thank you.
This is, of course, for the Archives of the American Association of Neurological Surgeons, and certainly will be of some historical value as years go by. Would you be so kind as to tell us about your background, where you came from, your place of birth, your family background, and some of the folks that might have influenced you towards medicine in your early years?
I grew up on a farm in Nebraska. My father was a farmer. I have no relatives who are physicians. I am sure that the physician is always one of the important citizens of our community, but none of this influenced my decision to be a doctor. In fact, I was a junior in college before I decided on a medical career, and we'll just become what influenced that decision.
Let me stop just a minute. We got some background noise there. You went on into college from your background there in Nebraska. Did you go to college in Nebraska?
No, I went to the University of Nebraska for one semester, but most of my college at North Central College in Naperville, Illinois. And this school has always had a strong pre-medical department, and about every year, 3 or 4 students from this college went to Northwestern, so I was fortunate enough to have this as my college and access to Northwestern.
And then on to medical school at Northwestern?
Yes.
I see. What influenced you towards medicine? What something come along in your life that turned you on to medicine and influenced you in that respect? In neurosurgery in particular?
It's very difficult to state why I decided on medicine. The neurosurgery part is a little bit easier to explain. At Northwestern, we had clerkships in surgery, and I was assigned to Loyal Davis's service at Passman Hospital, and this was right after his return from World War II, and he had a large accumulation of trigeminal neuralgia patients, and I was quite fascinated by this illness, and also the operation to relieve the pain. He also had saved for him a number of meningiomas, so I saw the good side of neurosurgery very early, and I think this influenced my decision toward neurosurgery. I think also I was quite fascinated by him as a person.
Well, I'd like to ask you a few questions about that just a little bit later in the interview. I think that's an important part of our time together. And then, assuming you did train with Dr. Davis at Northwestern,
yes.
When did you finish up your training program?
I finished it on December 31, 1951. And the next day I was associated with Dr. Davis in practice. At that time, the partnership consisted of Loyal Davis, Joe Tarkington, and I joined that group. Later on, Joe left our group because he was practicing in Evanston, and Dick Wetzel joined us. So the 3 of us practiced together for about 20 years.
Did Dr. Davis's son ever practice in Chicago?
No, but Dr. Davis's son Richard was our resident, and I would say that Dr. Davis, Nick Wetzel, and I were all attendants when Richard had his residency with us.
What was your particular interest in neurosurgery? I know that you've done a lot of work in the spine. What aspect of spinal work, what particular aspect of most interesting to you, what you felt like you made your contribution in neurosurgery?
Well, I think the interest in the spine was probably more apparent than real, but it did happen. Part of my residency was spent at the VA hospital in Hines, and as you probably know, this hospital was one of the 5 original VA hospitals to take the spinal cord injured patients in World War II. And at any given time, there were over 300 patients with spinal cord injury at Hines, and the neurosurgeons had a large responsibility in their care. Later on, downtown, when the Rehabilitation Institute of Chicago was formed, I became the neurosurgery consultant, and this again put me close to spinal cord injured patients. Actually, I was probably more interested in brain tumors than spinal cord injury patients, but that's the way it turned out.
In your active practice, what was your most favorite operation?
I think craniotomies for the removal of brain tumors.
Of course, you didn't have benefit of the laser, the microscope, and all those things that we have today. So you really had to work, didn't you?
Yes, as a matter of fact.
Power tools as well.
Not having done neurosurgery in the last 7 years, I've even missed the recent developments of the CT scan, the laser, and all I know about NMR is what I read about it. So I quit before a lot of the nice things came along.
Lasers made a real impact. Dr. Neblett is one of our leading authorities in laser neurosurgery. He can brief you anytime you'd like to come down to Houston. What would you say was your least favorite operation? We all have those, I think. We're honest with ourselves. Or let me put it this way: what would you, not your least favorite operation, what was the operation you wish you'd never done, or did not feel like was the most valuable to the patient, or to you as a neurosurgeon?
I think I always had a hard time doing a trigeminal neurotomy, and I've never quite understood why, because Dr. Davis was very good at it. We saw a lot of patients with trigeminal neuralgia when I was a resident, but I think this was always my most difficult operation.
It's been pretty well replaced now with percutaneous radio frequency procedure.
And I've had no experience in that at all.
A lot of things have changed, of course, in neurosurgery, as you've already alluded, the CAT scan, MNR, what have you. Is there anything you anticipate, say this is 1983, 17 years from now, year 2000, what would you anticipate the practice of neurological surgery to involve?
I imagine that solo practice is a thing that's of the past, and that we're going to have more group practices than we have today. And I don't believe that the group practices can be limited to 100 or so medical centers that are affiliated with universities. I think that neurosurgery is going to become very specialized. I believe it'll be better for the surgeons. I think it'll be better for the patients if that happens. And I can see that there will be neurosurgeons who do vascular type of neurosurgery, others who do the spine type of neurosurgery. And I think that there will probably be some interdisciplinary approaches. I think that orthopedists and neurosurgeons have a common ground. I think that neurosurgeons and head and neck surgeons have a common meeting ground, and I look for combined efforts. And I think this is going to be one of the changes in the practice of neurosurgery.
year 2000 is not far away. It's rapidly coming up. You've mentioned about Dr. Lowell Davis. Of course, we all know that he's gone now, but he was obviously a major influence in your life. Would you like to reflect on Dr. Davis and his impact on you as an individual, as a neurosurgeon, and of course his impact on neurosurgery as well?
Well, I think Dr. Davis is somewhat of an unusual neurosurgeon. His affiliation with the American College and SGNO made him sort of a general surgeon dash neurosurgeon. And I suppose that one can say that there are surgical neurologists and there are surgeons who operate upon the nervous system, and he would certainly fit in that latter group. He was a very handsome man, as you know, very articulate, and I think a very fascinating personality. This drew me to him, certainly. I think you know that he was the first man in Chicago to limit his practice to neurological surgeons, to neurological surgery, but he was certainly not the first person in the city to operate upon the brain or the spine. It so happens that I became his clerk in my senior year, and we had a very fine relationship, and I think that's when I decided to be a neurosurgeon. And somehow or other there was an understanding that I would probably be joining him after I completed my training. What else can I cut that?
Give us a little personal insight into Dr. Davis, maybe a little vignette about something that would give us a feeling for his personality, his wit, his humor, his intellectual capability.
Well, he was a very bright man. I think he was always at the top of his class in college and in medical school. But you may not know that he went into private practice in his hometown, which was Galesburg, Illinois. And it was during that time that he decided that was not for him. The nice thing about it was that when he returned to Northwestern, a very understanding man who knew how to handle him was Alan B. Kanavel. And Alan Kanavel did a lot of neurosurgery in those early days. In fact, he was one of the early members of the Society of Neurological Surgeons. And during this expanding period of surgery, Kanavel, who was a general surgeon, did all kinds of surgery, and was particularly interested in hand surgery and neurosurgery. And he told Dr. Davis, "You're going to be the neurosurgeon." Fortunately, also, Stephen Ranson was at Northwestern, Louis Pollock was at Northwestern, and Alan Kanavel made it possible for Dr. Davis to spend a lot of time with them. And then, just before going into practice, Dr. Davis spent about a year in Boston with Harvey Cushing. And of course, I think he was a great imitator of Cushing in practically every way. Another thing about Dr. Davis is that he was a very handsome person. People were attracted to him. I don't know that he had a great sense of humor. There's a difference between being able to tell a story and having a good sense of humor. I've never quite figured out whether he had a great sense of humor.
What was his demeanor in the OR? Can you describe a little bit of that?
Well, he looked upon the operation as an exercise, and everyone was supposed to know what his role was. The instrument nurse handled the instrument. The circulating nurse did nothing except circulate. The additional nurse kept supplies ready for the assistants. The first assistant supported the surgeon. The second assistant supported the first assistant. And he really had procedures worked out very well, and often spoke about this is an exercise. We've done all the work before we get here, and now we're just going to do it. It was a very well organized operation, and something which I don't think I've seen since. I think that in those days people knew their places better than we found to be the case later on.
Did you find this organizational capability was also true outside the operating room in his practice and in his personal life?
Yes. He was never totally relaxed. He was always working at it. And I think it was difficult for him to be totally at ease with people.
This may be a less than fair question. If it is, we will pass on it, but do you see much of the interpersonality of Dr. Davis is reflected in Mrs. Reagan now, or was there much of a similarity there?
Yes, I think that there's a similarity, and I think that Dr. Davis was rather proud of it. Mrs. Reagan is a very well-organized person. She always knows what she wants, and she has very little difficulty in letting people know what she wants. I think that she's done an exceptional job at the White House, and all you have to do is visit us, and you'll agree with me. I think that she learned her positive approach to things from him. She might even be a good imitator of him.
I can say for myself, when I talk to Mrs. Reagan, she's shown to me a great deal of admiration and respect for her father, for Dr. Davis. It seems to be that she had a strong feeling for him. Do you think that's correct?
That's definitely true. And the president and Dr. Davis were very close. Can we cut this in a minute?
Dr. Ruge, you are now, of course, living in Washington. When did you first come to Washington, and what was your activity here?
We moved to Washington in the spring of 1976. For some reason or other, I decided many years ago that I didn't want to be an old neurosurgeon. And there are only several ways that one doesn't become an old neurosurgeon. One of them is to die while doing it, and the other one is to make a change. And I had had a very good neurosurgical life in Chicago, but there there's no shortage of neurosurgeons in Chicago, as you know. So when I had an opportunity to come to Washington to be the deputy director of the VA Spinal Cord Injury Service, I thought that my past helped prepare me for this, and we made the move to Washington at that time. After several years as the deputy director of the service, I became the director, and that's what I was doing when Dr. Davis asked if I would like to be the position of the president. It so happens that Dr. Davis and I discussed my being the position of the president a long time ago. As I recall, the first time was back in 1976 when Ronald Reagan made a try for the nomination. We were already down here, and Dr. Davis at one time sort of facetiously said, of course, if he'd been elected, he would have been his position. I wasn't totally surprised when Dr. Davis asked me if I would be the position, and that happened 1 week after the election.
After the election,
Yes.
not the nomination.
No.
It was signed, sealed, and delivered. What was your immediate reaction? Of course, it was an opportunity that certainly very few neurosurgeons ever had to do, and you're certainly the first neurosurgeon I'm certain that's been in that capacity.
Well, this may surprise you, but it took me 2 days to decide to do it. In the first place, I thought that the position should be filled by a younger person, preferably someone in family practice or internal medicine. And of course, I knew the recent history of the position, and it was almost without exception filled by military people. I mentioned all these things to Dr. Davis and told him that I was honored, but that actually he had made the wrong choice. And he was quite positive about that, like he was about everything else. And my wife and I talked about it for 2 days, and finally I decided that we've only talked about the negative aspects. There must be something really wonderful about it, and I decided to be the physician.
What are those positive things that you anticipated and that you've experienced in these last 2 years or so that you've been the position of the president?
Well, I think you all know that Ronald Reagan is quite a terrific guy, and it's nice to be around him. I think that one sees things and hears things and learns things which you would never know in any other situation. I don't think anyone who doesn't work at the White House has any grasp about the size of the executive branch and all of the support that's required to maintain a presidency. I find this very fascinating. I think that I have met many nice people who are engaged in work similar to mine, and this brings us to where the position fits in the scheme of things. The position is part of the Special Support Service of the White House. Another word for that is the military office. And when we meet, this usually includes the pilots of Air Force One, the Marines who pilot the helicopters, the White House communications agencies, the mess, the commander of Camp David, ground transportation, and probably a lot of things that I can't think of at the moment. But the support of a president is phenomenal. And I don't think there's anything like it anywhere in the world, with the possible exception of Russia. I believe that their leaders get comparable support. Excuse me. I think their leaders get comparable support, but in no other situation does it equal the support that the president gets.
Last Saturday evening, we were standing behind the White House as the Marine helicopter was landing. The president was on his way to Andrews Air Force Base to be with the families of those returning from Beirut, tragedy over there. Where were you? Were you with him? Do you make every trip, say to even Andrews Air Force Base?
It so happens that I was not on that particular trip, but a physician was. And I would say that 95% of the time I am that physician. I don't believe that he was out of the White House 5 times without me the first 2 years that he was president. Since that time, it's happened more frequently. But I am manifested on the helicopter, I'm manifested on Air Force One, I'm even manifested in elevators. And the people who are with him the most are a senior Secret Service agent, a military aide, and a physician. The interesting test came one time when we were in the Capitol in Tennessee. We were on an elevator that only held 4 people. And I had some curiosity about who's going to make that elevator, and it so happened that I made it. It's amazing how many people have to be on the elevator with the president, and this is usually not a big problem in a big hotel with a large freight elevator, because you can get a lot of people on that elevator, but I guess the 6 or 7 people on the elevator, there's always almost who makes what the physician does.
Connotations, President Reagan. A lot of people in situations like that, sports figures, celebrities, are somewhat African tribal. Certainly could say that about the president. He seems like he's an excellent health.
Well, he is an excellent health, and he's a good person, and it shows through. I think that it's important to realize that presidents are in an awkward position by even having a physician. No one else is smothered like a president is. And I've made it a great point to not be near him except when it's necessary. You'll very seldom see me near him when he's out in public. I think that a healthy individual like Ronald Reagan would feel a little bit peculiar by seeing his doctor every time he turned around. So I've made it a great point to have a low profile. I don't look upon myself as the man who should be treating him if he became ill. I think it's my responsibility to see that he gets good care should he become ill. And I don't look upon myself as the sole provider of his care. Most of my time is spent seeing to it that he has good care no matter where he happens to be. The preparation for trips is extensive. We almost never go out of town without having 2 or 3 or sometimes 4 hospitals standing by. And this takes a great deal of planning by people in our unit. But it's something that we hope that the president isn't even aware of.
So you have your own support in that respect. You have all the various fields of medical specialty at your disposal to bring in should it be necessary.
Well, I think the fortunate thing is that there are 400,000 doctors in the United States who would do anything they could for the president. And the hospitals are certainly honored to be asked to be the hospital in the event of a problem. They've been very supportive. Fortunately, we haven't had to use them often. But there are many people who are standing by all the time, and I think this is an important aspect of his care in case it's required.
Yeah, you're solely the physician for the President, Mrs. Reagan, but the other staff have their own medical consultants, should the Vice President perhaps.
Well, the White House medical unit consists of 3 physicians, 3 nurses, 3 foremen, 2 physician assistants, and 2 secretaries. And we do provide care for the Vice President and his family. And we are sort of a triage for all the people who work in the White House. We talk about the White House, and that's the 18 acres, which includes the White House, the East Wing, the West Wing, and the old Executive Office Building. And my guess is that there are close to 3,000 people who work there. Many of them are in the military. I've mentioned some already who are in the military. And of course, you know, we have the National Naval Medical Center here. We have Walter Reed here. And we have excellent medical schools and hospitals in the city. And we try to get the people to the right facility, keeping in mind that they also have their own personal physicians in many instances.
Where is your office located in the White House? Is it within the White House itself or the executive offices?
My office is in the White House itself, and that's a rather interesting part. I think that tells you a little bit about the job. My office is in the White House. So is the housekeepers. So is the kitchen. So is the curator. The West Wing is where the action is from the government standpoint. My office is not over there. And
well, from a historical point of view, and closing our interview, March 31st, I believe it was, 1980.
I think it was March 30th, wasn't it?
March 30th, 1981 was a historic time. It just so happened, interesting, Dr. Neblett was here in Washington just a few days before, visiting Vice President Mrs. Bush, and I had come to Washington with my children, and we were visiting with several folks in the Secret Service that were showing us around, and several days they showed us the actual car and some of the things that were used by the President. And 4 or 5 days later, we had this national tragedy. Where were you at that time, and what were your thoughts at the time the assassination attempt occurred? And just what was your plan of action and your and the way things handled, and how were people called in, and the President or Press Secretary Brady?
Well, I was with the President when the shooting occurred, and was probably 10 or 12 feet to his right. And I heard the shots, and I knew there were bullets. And immediately saw people lying on the ground. I happened to remember that the President was wearing a black suit with white pinstripes that day, and there was no black suit with white pinstripes on the ground. And when I became aware of that, I saw his limousine pull away. At that point, I made a run for the car that I was assigned to, and we all went down Connecticut Avenue about the same time. Jerry Parr, who was the senior agent at that time, and I were quite close. He had been the senior agent for President Carter prior to being President Reagan's agent, and we talked about things like this, and on that particular morning discussed using George Washington Hospital. The fortunate thing about the afternoon was that we were returning to the White House when the shooting occurred. That made all of Connecticut Avenue free of traffic. So the limousine and support cars had Connecticut Avenue cleared. This, of course, was very, very important. It was during our ride down Connecticut Avenue that Jerry Parr, who was with the President, decided that we should be going to George Washington Hospital. It took me a long time to realize that there was also very little traffic on Pennsylvania Avenue. But that was the case, and now I understand why, and that is that the traffic was stopped where 17th Street crosses Pennsylvania Avenue, so the run to George Washington Hospital was done very promptly. And this short ride, or the little time required for the ride, was very important in saving the President. It was also very fortunate that George Washington University Hospital has an emergency room which is accustomed to treating trauma patients. And I can't say enough for them. They were there immediately. My own initial impression was that the President had not been shot. I thought that perhaps he'd had a myocardial infarct because he looked ashen gray, and we had been told that he hadn't been shot. I must say I was quite relieved when I saw that he had been shot, because I thought that we were now faced with a problem that could be dealt with. And it was dealt with very well. I had nothing to do with his care. I felt that my responsibility was to see to it that the people who were going to take care of him could do it without being impeded in any way. And I think that's what I devoted that day to, and perhaps the next week. These men had taken care of many patients in similar situations, and my contribution, if any, was to see if they could do their thing, and they did.
A member of our society, Dr. Arthur Coburn, of course, is a prominent neurosurgeon here in Washington. He was involved in the care of Press Secretary Brady. Is that correct?
Yes, and I did have something to do with that. You may not know it, but Art was a resident of mine in Chicago one time. And Art and I have been very good friends during the last 7 years that we've lived in Washington. I had to get out of the emergency room for some reason or other, and I saw Art standing out there, and I had also, by this time, been confronted with Jim Brady's problem. There were some physicians taking care of Jim in the emergency room, and when I saw Art, I asked him if he knew who they were, and he said, "They're my residents." I said, "Well, why don't you join them? You have a patient." So actually, I asked Art to take care of Jim Brady, it so happens that the people who took care of the president were the people who were on call that day.
Those folks that take the local walk-ins, is that right?
That's right.
So this is all somewhat kind of a deja vu for me, because I was a resident of Parkland when President Kennedy was brought there, and I was involved there to a certain extent with that, and certainly relived every bit of what you all went through, and just having been in Washington just a week before and visiting with the Secret Service, because they knew my situation in Dallas at the time, and it was just too close to be to the truth. It was quite unnerving in a way, but it was very interesting. It's a tremendous opportunity that you have, certainly, and I hope that, and I'm sure you will, put your thoughts over the years in a book. And that you neurosurgeons have had an opportunity to record this, and I'm sure there'll be some things that come along that you can share with all of us in the future as you have today. And we're most appreciative of you taking time to visit us.
So thank you very much. I doubt there'll be a book.
All right. Charles, do you have anything you'd like to add before we
If I could ask one last question, perhaps. You mentioned in the year 2000 changes in neurosurgery, and specifically two things: more subspecialization and interfacing with more specialties within medicine. I'd like for you to advance that thought a little bit further and give me a feeling of how you feel neurosurgery in particular can interface with the politics of medicine and that aspect of our very, very important aspect of our neurosurgical lives.
I don't know that I can really answer to your satisfaction. What I actually have in mind is that I think that neurosurgeons can learn a lot from other disciplines. I think that other disciplines can learn a lot from neurosurgery. When I was in practice, I did a fair amount of work with vascular surgeons, orthopedic surgeons, with otologists, and neck surgeons, and I always felt very comfortable about it. I think that I think that all of them have their own approach to things. I think we have an approach to things. And I think that we can become very narrow and limited by not using each other more. I'm sure that the dispute about who is to take care of the acoustic neuroma will go on forever, but obviously we have learned something from otologists. I'm sure they've learned something from us, and I think that the problem of craniofacial resections is better done in collaboration with neurosurgeons than if the head and neck surgeons did it without us. I think that in the specialty of neurosurgery itself, that patients are not anxious to be operated upon by the surgeon who only does 1 or 2 aneurysms per year. I doubt that many of us would like to have our spinal cord tumors removed by somebody who only does a few a year. And I think this could be alleviated a great deal if we had more groups who affected specific areas of neurosurgery.
Do you think that will be done sort of on an elective basis by neurosurgery, or do you foresee the government interfacing there and saying you all provide regional health care centers?
I think it would be better if it were done voluntarily and that individuals decide that's what it's going to be. But I have no doubt that the government will get involved in this, especially if the government is going to be paying for it. And I think that's one of the unfortunate things of the past. I think it's too bad that many things have been taken away from physicians. But the reason for it is largely because philanthropy is dead. People have not obtained funds from private sources for medical education, for training, for research. And after World War II, we all know that the government was very generous with the bucks, and we started to depend on that. So I think that it's unfortunate that the government had to get involved in it as much as it did. But maybe it isn't too late to do many of these things on our own.
Do you think there may be a point now where government would be more than willing for us to assume leadership and aggressive roles? For example, what we were just talking about, if we perceive a problem and confront it and solve it, then they would be more inclined to say, you've solved the problem, we do not need to intervene.
Well, I think that this particular administration would go that way, and it happens to be my own conviction of prejudice also. I think that's what volunteerism is about to a degree. I think most of our institutions, they started as private institutions, were endowed by private sources. We've lost an awful lot by neglecting that source of revenue, and the time has come when the government can no longer do these things. Maybe some people aren't upset by the fact that health care takes 10% of the gross national product, but it does disturb me. I'm aware of the fact that health is just as important as a strong defense. But we really have overextended ourselves in many respects. And yesterday, for example, we heard this very fine discussion about NMR, and one of the things that startled me was that the examination would probably cost $1,000. Well, if that's going to be the case, somebody's going to decide how many people are going to get a $1,000 examination.
Thank you very much.
Dr. Ruge, for the President Frank Wren, and for the officers and members of the American Association of Neurological Surgeons, we're very grateful for your spending so much time with us today.
Well, thank you very much.
Thank you. Dr. Ruge, tell us about your family. You're married. Tell us about your wife and your children and what they're doing at this time.
All right. I married a classmate of mine in college, Greta Piper. We were married while I was a medical student, and we have 2 children. Our daughter Charlotte is in her early 30s, and she's married to a young attorney who lives in Washington and is very much interested in the environment, and she is now a freshman at Georgetown University Law School. We have a son, Tom, who lives in California. He thinks he would like to be a motion picture director. He's a graduate of Berkeley with a communications major and is on the production end of television commercials. But he's interested only in the production end. He's not interested in being an actor or performer.
In this job that you have now, do you find that it is more time consuming and less time to be with the family than even as a busy neurosurgeon 20 years ago?
It's very similar to being either an intern or a resident or in practice. It's not quite the way it was when I was the deputy director and the director of the Spinal Cord Injury Service. I find it very confining, and I think that my wife is paying a price by my doing this.
Do you anticipate seeking a second term of the president?
I don't know if I'd be good for all 8 years, but I would certainly like to stay beyond the first term. And I think it depends a great deal on his wishes. So far, I think that he'd probably let me stay on, but one never knows.